各位傳媒朋友早晨，多謝大家。
Good morning. Welcome to the press conference today. With us today, we have the Chief Executive as well as the Chief Secretary for Administration and Financial Secretary. The Chief Executive will first speak, and the floor will then be open for questions. Please maintain social distancing and keep your mask on at all times. Chief Executive, please. Friends from the media, members of the public, good morning. At the press conference today, we will brief you on our work in relation to COVID over the past month, as well as our way forward. At press conferences last week, we mentioned our work in this regard. That is, on February the 22nd, the SAR government announced a set of anti-epidemic measures in relation to the fifth wave of the pandemic, and we indicated that most measures will be extended till April the 20th. So why are we carrying out an interim review? Today is March the 21st. It has been 4 weeks since the last announcement, and we will reach April the 20th 4 weeks later. And one reason was the changes in the pandemic. On February the 22nd, I announced the anti-epidemic measures I mentioned. At that time, Hong Kong had a total of 53,943 positive cases and 145 deaths. At that time, we believed that the COVID-19 pandemic would worsen rapidly, and the next 2 or 3 months would be crucial. And based on such analysis, the measures we announced on February the 22nd would be extended all the way to April the 20th. In the past 4 weeks, Hong Kong has been through a severe situation. As of February the 22nd, we had some 53,000 positive cases in total. So looking back, it was only the beginning. As of yesterday, the cumulative number of positive cases exceeded 1 million, and we saw 5,683 deaths. We can take solace from the fact that we were able to curb the pandemic, and according to experts, the pandemic has peaked, and this is clear when we look at the 7-day moving average. And we can refer to other indicators to identify the trend of the pandemic. Since February the 26th, the CHP of the Department of Health started accepting rapid antigen test results as positive cases, and that way we were able to comprehensively understand the situation in Hong Kong. So in terms of the number of positive cases from the 1st to 22nd of February, and incorporating the RAT self-declared positive results, we could see that we have experienced a peak period. Another indicator is the overall situation with sewage surveillance. As we explained yesterday, the viral load per capita showed a declining trend. Compared with February the 22nd, the viral load dropped substantially as of March the 20th, but we did see a rebound the past 2 days, and hopefully this trend would not continue. And yesterday, we briefed you on our restriction testing declaration operations. We carried out more than 250 such operations. So in terms of the compulsory testing imposed in restricted areas, we could see that the number of cases has shown a downward trend overall. When you look at the orange line, you can see that we still face fluctuations. We could not say so far that the number of cases uncovered through the LTDs is declining. For PCR tests, they are mainly conducted at community testing centers and mobile specimen collection stations. And these cover mandatory and voluntary testing. Recently, more people have resorted to RATs, and that is why the number of PCRs conducted at these facilities dropped over the past 10 days. About 100,000 tests were conducted per day, and the ratio of positive cases detected saw an obvious decline. On 17th and 18th of March, there was a decline of more than 10%, which was great to see. And in terms of the effective reproduction rate, the Li Ka-shing School of Medicine has been monitoring the R0 figure. The latest figure has dropped below 0.5%. And on February the 22nd, when the measures were announced, the ratio was 3. Another reason we have to conduct this midterm review is reinforcement of our capabilities. And in recent days, the SAR government has reinforced our testing capabilities thanks to the support offered by the central government. And we have strengthened our capabilities in different areas in terms of the testing capacity. Our local contractors are able to conduct 300,000 PCR tests per day, and the mainland can offer substantial support by deploying sampling offices to Hong Kong and transferring samples to Shenzhen for analysis. The RAT kits are in abundant supply and they are widely used, and we have distributed more than 8 million RAT kits for free. If the results show to be positive, one could make a declaration through the self-declaration system, and it has operated smoothly so far. The CHP has reviewed the self-declared cases, and no substantial abuse was found. And in terms of the anti-epidemic medical supplies arriving in Hong Kong from the mainland, they have been safeguarded with the strong support of the central government. And in due course, we will be distributing anti-epidemic kits to all households in Hong Kong.
I'm grateful to the electrical members, district organizations, clansmen associations for their voluntary raising of funds for distribution of these supplies. And they are tying in with the administration in the distribution efforts. Within this week, work will be getting underway. In the kit, we have the RAT test kits to facilitate the household members to undergo a self-administered test to ascertain their COVID status. As more members of the public are getting infected and they are testing themselves at home and they are self-isolating at home, there was a time when we had to play catch up, but right now these support measures have been improved. Now we have the anti-epidemic kits, which contain a whole host of items like thermometer, proprietary Chinese medicine, and oximeter, and so on. Now in these, the distribution of these anti-epidemic kits is done properly. I've looked at the numbers over the past 3 days, and they have covered the infected people and the close contacts up to 100%. They've done it through the referral of the DH. There are 280 hotlines from the HAD and 150 hotlines from the HA. The 23 vaccinated clinics are also in operation. 1,800 taxis and minibuses are available as part of a dedicated fleet to ferry people to the dedicated COVID clinics, and also to the CIFs. So people are transported from their homes to these facilities. CIFs and CTFs, we have also ramped up the scale. We have the makeshift hospitals supported by the mainland. Each hospital can accommodate thousands of beds. This week, we're going to have one of the largest makeshift facilities that will be made available this week. We are looking after those who are in stable condition, the elderly people who are in stable condition, but not yet ready to go back to their homes. Now we have the holding centers. Today, we've announced that starting from today at the Kai Tak cruise terminal, we have 1,200 bed holding center that will be coming on stream gradually. The HA, having regard to the mainland experts' views on focused treatment, has already strengthened the Tier 1 and Tier 2 beds. The QE hospital and various other hospitals have been converted into dedicated hospitals for the COVID patients. So the number of beds for COVID has increased to 15,000. With the support of the mainland experts, we have managed to ramp up the capacity of the AWE for the third tier facilities. Private hospitals are working in collaboration with us. 1,000 beds have been made available to take on the non-COVID patients referred to by the HA. At the beginning of this month or mid this month, we have started using the 2 antiviral pills to minimize hospitalization and progression into severe cases. Now, 3 batches of mainland experts have come to Hong Kong. I've met them all, and we benefit a lot from their input and their recommendations. We are truly grateful, and all these advice is really good for reference. Third, in answer to questions last week, I touched on this, and that is socio-economic development needs. Hong Kong is, after all, an economically prosperous society. There is a need for society to function continuously and for the economy to move forward progressively. So there are 3 areas where we have to review the measures. First, in the fifth wave, 9 countries have been imposed a circuit breaker flight ban, and this is no longer necessary because in these countries they are no worse than the situation in Hong Kong, and most of the travelers coming to Hong Kong do not have any symptoms. If we have this circuit breaker flight ban, a lot of Hong Kong people stranded in these jurisdictions will be really troubled, and we fully appreciate their anxieties and concerns. Some said that for the inbound travelers, the quarantine requirement is far more stringent than the infected people in Hong Kong and the close contacts in terms of quarantine and isolation. Things are more stringent than these inbound travelers. And this would affect our business environment, particularly in the US and European countries, and they're moving in the direction of relaxation. Third, we have to maintain our perseverance and confidence. The businesses and the members of the public must understand the direction of our anti-epidemic measures. Parents should know about the arrangement for class resumption, and we have to make preparation for a relaunch of our economy. In the 2022 employment support scheme, this is entirely to pave the way for the relaunch of our economy. I've brought along the CS and FS to this press conference because this review is no simple task. We have to have regard to a whole host of factors, social factors, economic factors, and so on. All these combination of factors have been taken into account. The steering committee has considered all these factors over the past couple of days, and I am chairman of this steering committee, and all the bureau directors are part of this discussion for the decision to be taken. First, the COVID situation is still severe, so we have to maintain our anti-epidemic work. So all these measures announced on the 22nd of February should be extended until the 20th of April. So most of these measures will not be relaxed ahead of time. But having regard to the changes that I mentioned, we're not seeing any upward trajectory, because otherwise we will be very, very concerned. Now, there is about a month or so before the 20th of April. I think we have to focus our attention on treatment to minimize severe cases and deaths, and to take the pressure off the hospitals, and also to improve the situation in the homes. If you pay attention to the 4:30 press conference, the number of outbreaks in the RCHGs and RCHDs is much lower. You may say that we've seen a lot of outbreaks, but this is the time we want to help them to recover. We have set up for this purpose a lot of holding centers for the elderly people who are in stable condition, and we put them there in the holding centers, so that the homes can recover themselves. We have also relaxed the importation of labor, so that we will have more carers to welcome back the elderly citizens.
會進一步擴大核酸檢測嘅能力。
Later this month, we would further expand our PCR testing capacity, as we announced yesterday. The CTNs, which were no longer issued in recent days, would be restarted based on our assessment, and we would promote the extensive use of RAT kits. So in the anti-epidemic service kits that we will distribute soon, they would contain RAT kits, and we also urge NGOs to help distribute these kits to the public, especially vulnerable groups. And according to the CHP, the RAT test results must be declared within 24 hours. That way, we can identify and treat patients early. We have established a series of objectives to boost vaccination rate by the end of April. And we set some targets on February the 20th, and they were largely met already. For members of the public, age 12 and above, the vaccination rate for the first dose exceeded 91%. For the second dose, the current vaccination rate is 82%, and hopefully in a month or so, this could be raised to 90%. For children aged 3 to 11, vaccination only started at the end of January. The vaccination rate for the first dose is currently 57%. Hopefully by the end of April, it can reach 90%. That way, they could be more reassured when they come back to school. For elderly people living in residential homes, currently the first dose take-up rate is 55%. But since some elderly people who have contracted disease could not receive the next dose within a certain period of time, so by the end of April, for elderly in residential homes, we hope the take-up rate for the first dose would reach 90%. Finally, for elderly people aged 70 and above, the take-up rate for the first dose is currently 70%. More than 280,000 elderly people aged 70 and above are yet to be vaccinated at all. I hope the media can make more reports on why the elderly people should be vaccinated. In order to boost vaccination, we would fully implement the vaccine pass. The first stage was implemented on February the 24th. For stage 2, that is, people could only enter premises after receiving 2 doses, would be implemented on April the 30th. For stage 3, that is, the requirement to have 3 doses of vaccine would be advanced to May the 31st. So we urge those who haven't received the 3rd shot to get vaccinated soon. Like I said, according to the steering committee, the pandemic remains severe and most measures will not be relaxed. But we will be rationalizing the following measure. Starting from April the 1st, the SAR government would abolish the flight embargo on 9 countries and rationalize the immigration and quarantine arrangements as follows. This might be of much interest to many Hong Kongers overseas, and they might want to come back soon. Under Cap 599E, starting from April the 1st, we would implement the following measures, which would apply to all inbound visitors from overseas. In other words, we will no longer classify overseas countries or regions as type A, B, or C regions. In the first stage, the arrangement would apply to Hong Kong residents. Only vaccinated Hong Kong residents can board a flight. So normally that refers to Hong Kong residents who have received 2 doses of a vaccine and 48 hours before the expected flight, a PCR negative result must be produced and a confirmation letter at a designated quarantine hotel for at least 7 nights must be produced, and they must proceed to a test and hold arrangement after arriving at the Hong Kong airport. If the traveler tests negative at the airport, we would issue a 14-day quarantine order. Even for individuals to be quarantined and isolated in Hong Kong, they would be subject to a 14 quarantine order as well. And the visitor would arrive at the designated quarantine hotel via a designated fleet. And during the quarantine period, the individual must carry out an RAT every day, and the RAT kits would be distributed to such individuals at the airport. Apart from daily RAT tests, on the 5th day at the quarantine hotel, the visitor must complete a PCR test, and in case of in a 14-day stay, the visitor must also carry a PCR test on day 12. For one undergoing quarantine at a designated hotel, even if the quarantine period is 14 days, if the PCR test on day 5 and the RAT results on day 6 and 7 all test negative, the visitor can leave the quarantine hotel early. This is completely in line with the quarantine arrangements for those on quarantine and the close contacts of these individuals. If a visitor chooses to leave early, he must carry out self-surveillance in the next 7 days. And on day 12, he must complete a PCR test at a community testing center to confirm that he wasn't infected at the quarantine hotel during the quarantine period. If the visitor does not choose to leave the hotel early, on day 12, he would complete a PCR test at the quarantine hotel, and if the result is negative, the quarantine period would end after 14 days. For inbound visitors, test positive via a PCR test during the test and hold period, or if the PCR result on day 5 or 12 tests positive, or if any of the daily RAT results test positive, then he would be transferred to a community isolation hotel. In theory, there should not be any infected individuals at quarantine hotels, so those who test positive would be sent to a community isolation hotel, and by then the individual would be issued with an isolation order and be subject to isolation requirements. The requirements are in line with locals who are undergoing isolation. If the RAT results on the 6th and 7th day were negative, the isolation could end. And in terms of, so these were the requirements for inbound visitors.
啲小朋友
Schooling is very important to the children. I understand that parents are really concerned over the past 2 years. The in-person schooling has been in fits and starts, and according to the plan, as soon as April the 19th, in-person classes will resume. We'll start with primary school, international school, and kindergarten. For secondary school, we'll wait until the DSE to finish before we resume. The DSE is aimed to be starting on the 22nd of April. The Education Bureau is considering the contingency measures where necessary to delay the start of the DSE. After resumption of class, the vaccine pass will cover the teaching staff and the visitors. We do not require the students to be vaccinated to resume the in-person classes. We respect the children's right to education. But for the children, if the vaccine coverage is high, then it would provide the right condition for the activities to be resumed, like extracurricular activities and board games and so on. We're more relaxed about the secondary schools at 12 and 19 children. It's not the vaccine coverage is 95%. We are pushing the second dose. In the light of experience, those who have received one shot would normally be proceeding to the second shot. Now, for 3 to 11, there is a lot of catching up to do. They started in November. The vaccine coverage is 57% for the first shot. Before April, end of April, we'd like to raise the level to 90% from 57%. Lastly, I'd like to talk about the social distancing measures. The steering committee command center is of the view that the COVID situation is still severe. We may have gone past the peak, and there is a sign of downward trend. But this is not enough to make us feel at ease. The number of 15,000 to 20,000 is still a pretty high number compared with the previous waves. The peak was something like 150 daily. This is 100 times over. So under these circumstances, it would be hard for us to relax all these social distancing measures right now. If there is no sign of a rebound, if the trajectory is showing signs of going down, then starting from the 21st of April, we will be relaxing most of the social distancing measures in 3 phases, in 3 months. So most of them will be relaxed. But there are still some measures that we will insist, like the use of Leave Home Safe app upon entry to premises, and also the use of the vaccine pass. Premises have to be disinfected. There should be a number cap in public places, and also the wearing of face mask. Now, previously, we tightened them gradually and relaxed them gradually. Now we have a clear roadmap and a timetable. We hope that there will be 3 phases in 3 months. First, we will be reopening these premises. Don't read them out one by one. The premises under 599F and also the sports venues, museums, performing venues, libraries will be reopened. So, but this is on condition that people will be wearing their face mask, except for the F&B premises, because people have to eat. For the others, there is a mask requirement. Now, for the group gathering restriction, it will be relaxed to 4 people. Light dining can resume with 4 per table. Bars and pubs will continue to be closed until the next phase. That's the situation for the time being. For the second phase, all the remaining scheduled premises will be reopened. And the number of people or the group gathering will be relaxed to 8 people. Beaches under the LCSD will be reopened. Jogging or strenuous activities outdoor do not require the wearing of face mask. And also in the first phase, it was relaxed to 10 to 12, and the number of people will be relaxed to 8 people, and bars and pubs will be reopened in the second phase. Now, for the third phase, basically all the remaining elements like the number of people, they will be relaxed, and basically we will resume or go back to a situation where we have the basic requirements like face mask, disinfection, a number of people, the use of Leave Home Safe app, and the vaccine pass production, and so on. Another area of concern is on the 22nd of February, we announced the CUT, the compulsory universal testing. After assessment by the committee, we decided to hold this in abeyance. We have done a lot of work over the past month. We have finalized a lot of the elements of the plan. We have assessed the manpower capacity, manpower requirements. That this CUT, if implemented, will be really on a massive scale, and there will be a necessity for restriction of movement. But having regard to the experts from locally and also from the mainland, that they do have very much a consensus. They are of the view that the universal testing should be undertaken at the beginning or at the back end of the outbreak. The beauty of doing this at the beginning is to curb the spread of the virus. This is the timetable adopted by the mainland. For the latter one, it is intended to achieve zero COVID. Now we will be picking up the remaining carriers, and we'll be able to achieve zero COVID. But given the situation in Hong Kong, the COVID situation may be easing. The number is still on the high side, as I said. So the experts are of the opinion that it's not appropriate for us to devote all the finite resources to the universal mass PCR test. Some experts, not least the mainland experts, think that the community organization ability is weaker by comparison with the mainland. In the mainland, they have the street management, they have the district management network, but in Hong Kong, it is weaker in this area. So we may have the legal backing. It would be hard for us to achieve an objective of universal screening. So when we decide this suspension of the CUT, the SL government will continue to monitor the situation. Where the conditions are right, we will consider whether we will be implementing the compulsory universal testing. So to sum up, we have assessed the situation, but this is only a roadmap. At this stage, we will continue to monitor the development of the virus. Things can change very quickly, and I think people feel that time is passing very slowly at this point in time. But we will monitor the situation together with the experts. We will be listening extensively to views from the public and decide on the anti-epidemic measures that focused, and we will be people-oriented, and we will be achieving the best possible results with the minimum resources and minimize the impact on society and also on the economy. So much I have to say. We'll be only too delighted to answer your questions.
We now proceed to questions and answers. Please raise your hand and identify your organization before you speak and speak into the microphone. This is an interim review, so I believe quite a number of reporters might want to ask questions. So as usual, please restrict yourself to no more than 2 questions, and you may not ask follow-up questions. The lady on the back row, please. Good morning. Can you speak up, please? I'm from cable TV. I have a question about the amendments to the employment ordinance. A bill was introduced into LegCo to allow employees to apply for sick leave with their isolation order or quarantine order, but there were reports that there were complaints from the business sector. They hope that the government could bear half the pay for sick allowance or sick leave. And the reports said that EXCO members voiced their discontent as well. They signed a petition to oppose the arrangements on flight. So did the chief executive decide on the adjustment today because of such discontent? And in terms of the hospitalization allowance, some people from grassroots families said that they have exhausted their sick leave. The government indicated that a $5,000 hospitalization allowance would be sent, but for patients who stay at home, they could not apply for the allowance. Would you relax the threshold, or are you wary of any abuse of the measure? So would the allowance be only offered to those who were sent to hospital? You asked 3 questions. At prior press conferences, I have said that we have seen issues between employers and employees during the pandemic. In order to minimize the conflicts, we propose amendments to the employment ordinance to cover different areas. For an employee who has to be quarantined since he's a close contact, or an employee who needs to be isolated, then they would be eligible for sick leave. Based on the employment contract or employment ordinance, employees would be entitled to sick leave. So this has been the practice, and we simply look to clarify the issue. And we also outlined 2 scenarios in which unreasonable dismissal would not be constituted, including the requirement by an employer for their employee to be vaccinated. I see this is a very reasonable request, so I see no reason why the government should be involved. We have offered a number of support measures, including the 100% special guarantee scheme and the $30 billion employment support scheme for employees who tested positive or those who could not go to work owing to certain legal requirements. The employers should shoulder their responsibility. As for the discussions among EXCO members and their discussions with myself, I cannot disclose the content, but I would say that we have heard plenty of views at recent times, including those from ex-official EXCO members, views from the business sector. Last week, we heard from the International Business Committee and consul generals in Hong Kong, and that's why we came up with such proposal, and speculation is unwarranted. As for your 3rd question, the SWD would work out the arrangements for those who could not go to work since they tested positive. And earlier, we announced the temporary unemployment relief and a one-off subsidy of $10,000 would be offered to those who tested positive, and this would offer relief to those who could not work because they tested positive. Next question, please. The lady in the middle.
This lady.
I'm from Hong Kong Economic Journal. Mrs. Lam, you said the compulsory universal testing would be suspended. how long would it be suspended? Does it mean the government would adopt the strategy of living with COVID? In terms of the Whitman Home birthday bash, you said investigation was completed, but the FEHD has yet to come up with investigation results. Why did it take so long? Are you worried that this is not in line with public expectations? Like I said, the timing for compulsory universal testing is crucial since the scale is massive and a CUT exercise might bring inconvenience to the public. So having assessed the situation as well as views from experts, our view or our decision is to suspend the exercise. Whether or not it will be carried out later, it would depend on how the pandemic pans out. According to the CHP, for people who tested positive and recovered after December the 31st, they would be exempted from any compulsory test in the next 3 months. So for restriction testing declarations, we have indicated clearly to residents that if they recovered from COVID within 3 months, they would not be subject to the compulsory test. Some experts believe that a few million people in Hong Kong had been infected. So if we are to carry out CUT now, there could be, well, things could be chaotic. For people who tested positive, not all of them might be on our database, since some of them did not declare their positive results. So that's why we would not be carrying out the CUT right now. We will continue to monitor the situation. For some time, there were heated debates in Hong Kong on the approach of the exercise. So this is just an interim assessment and conclusion, and it could be subject to changes. If we see another pandemic in the future, whether or not it's COVID, we would continue to embrace a science-based approach while minimizing the impacts of the pandemic on Hong Kong's economy. And at a suitable juncture, we would make further announcements. As for the law enforcement work, I could not speak on behalf of the enforcement agencies. So you can follow up with the FEHD on the latest investigation results. Next question, please. The lady on the front row, please. Good morning, this is Now TV. In terms of local anti-epidemic measures, can we consider April the 22nd a deadline if we see a further declining trend in the pandemic this month? Could some social distancing measures be relaxed early? Chief Executive, you said that people are becoming less tolerant of the measures and many people in the community have recovered from COVID. So is there room to relax certain low-risk social activities? As for the flight embargo, it would be lifted on April the 21st. So for a long time, people from certain regions could not enter Hong Kong. Did it lead to a loss in talent from headquarters in Hong Kong? Why would the embargo be lifted in April and not right now? In terms of this interim arrangement, does your assessment include the timing of the chief executive election? Are you still confident that the election can take place in May?
On his first question, simply put, there is no room. We have this midterm review today. The social distancing measures will continue until the 20th of April. We hope that on the 21st of April, we will be moving on to the first of the 3 phases of relaxation. Now, people may be desensitized to the COVID positive numbers. I mean, we have, in fact, 10,000, 20,000 cases, and they are presenting a lot of risks to the community, a lot of pressure. So I would urge the members of the public to be more patient with this timetable and roadmap. As long as the trend is coming down in 4 weeks' time, we should be able to resume normal life. So from now to the 20th of April, we still have to observe all these social distancing measures. Second, as regards the circuit breaker flight ban, I must admit that this is a very stringent measure. Over the past 4 waves, there was a brief period that we applied this to one country, and I think it was the UK. Now we have to have regard to the COVID situation in these places. At the beginning of the year, the situation was pretty serious. There are still a couple of countries where they have registered 50, 60, 70,000 cases per day. And we have a lot of people coming back from these countries. If we don't have a lot of people coming back from these countries, then we're not that concerned. But if the number is high, like I said, if there are a few dozen infected people on the same flight coming back, they will impose a very heavy burden on our healthcare system. I mean, even if there are impacts, the impact would be for a short period of time. The FS might wish to supplement as to the how serious these impacts are. Now, the 1st of April represents the earliest that we can implement this, because if we want to resume flights to Hong Kong, and more people will be put under test and hold at the airport, and more people will have to pre-book the quarantine hotel and the flight tickets. And this is no easy matter. And we've seen the situation in the past, and it would take at least 8 to 10 days for these to be sorted out. So we are seeking to have the earliest time, i.e. the 1st of April, for the flights to be resumed to Hong Kong. In order to achieve this April 1st objective, all the relevant departments are discussing with the arrangement with the airport authority. We have to notify all the airlines for them to make arrangement for the resumption of flights. We have to amend 599E and 599F, and the Port Health division of the DH will have to ramp up the rapid PCR test capability. Now, with such a large number of people coming back to Hong Kong, we will have to ensure the efficiency. At one point, we had a few hundred people coming through the airport, but with this kind of number, they have to make the preparation. The other thing is the hotels. We have 25 quarantine hotels with 6,500 rooms available. I've just asked my colleagues to double check, and the booking level is 67% at the moment. Now, if people have to pre-book the hotel rooms afresh, unless they have already made a booking, it would be rather difficult for them. So we are liaising with the trade to see whether more hotels are going to be taking part as quarantine hotel for so the people stranded in these 9 countries will find it easier to book the hotels. people will need to pre-book for 7 nights. Previously, it is 14 nights, so that would free up some of the capacity of the hotels. Third, I don't have anything to supplement from the legal point of view. The nomination and election of the chief executive will be the same as I said earlier. I defer to the FS about the impacts. Speaker not coming through. FS not coming through. Speaker not coming through. FS not coming through. Well, in terms of our competitive edge, I think we have to be confident. When the pandemic is under control, we will maintain our vigilance in the context of dynamic COVID-0 policy. We will seek to reopen the border. As the chief executive said, there will be some adjustments to the flight ban, and people who are vaccinated and who have the negative PCR test results, and that there will be some adjustment for these people. Also, the economic growth in the mainland is really robust, 5.5%. That's indicated in the working report that the Greater Bay Area presents ample opportunities. There are many companies that are headquartered in Hong Kong. Many enterprises and many business people would use Hong Kong as a hub to serve Hong Kong and North Asia, not least the mainland of China. So as long as COVID is under control and the traveling is resumed, we will be able to maintain our attractiveness. The economic condition would be good. In innovation and technology and so on, we are making a lot of improvement. I'm sure we will be able to overcome these short-term challenges and let's stand united against this pandemic and recover, enable the economy to recover. Next, please.
形式口罩嗰位女記者。
The lady on the front row, please.
News. What you just laid out with the phase easing, it looks a lot like the roadmap that countries who are seeking to live with the virus have followed. So are you definitively decoupling from the mainland and moving away from COVID-0? And once this outbreak comes more under control, will you still prioritize the reopening of the border with the mainland over opening the international border? Thank you.
As I have said in the concluding slide, what we have assessed and announced today is only a sort of a stage report, okay? And try to provide as much direction as possible to the business and people of Hong Kong to really map out a longer-term roadmap, not only in dealing with this particular wave, but also a future wave. And not only in dealing with COVID-19, but perhaps another virus in future, we do need to do more monitoring of the epidemic development, including what the World Health Organization has to say about this pandemic. We have to listen more carefully to the experts, both locally and from the mainland. And since we also are very concerned about the socio-economic development, we will widely consult the various stakeholders in Hong Kong and to come up with a more permanent pathway for Hong Kong to tackle any public health crisis in a more targeted manner that will, other than the overriding mission of protecting the safety and health of the Hong Kong people, and also basing on evidence, we should also take into account the impact on the social and economic development. So right now, I would advise that you need not draw any conclusion of what we are heading towards in the announcement that we have made today. But what is important is what the FS has just said. We are always, as an international city and a very important business and aviation hub, we always will have to take into account not only connectivity with the outside world, but also connectivity with the mainland. As FS has rightly pointed out, many international businesses have chosen Hong Kong. It's because of our accessibility to the mainland market, and also, of course, in the Asia-Pacific region. So for any longer-term public health strategy, we will have to take into account both factors. That is maintaining Hong Kong's accessibility to the mainland and also ensuring her continued connectivity with the outside world. Thank you.
好，我哋問多一位記者提問。
Final question. A gentleman on the back row, please. Chief Executive, this is RTHK. I have 3 questions. You said a lot of assessment was carried out in relation to compulsory universal testing. So if a CUT exercise is to be carried out, how much manpower and expenditure would be involved? We are still a month away from relaxing social distancing measures. Let's say in 2 weeks, if the pandemic improves substantially, for example, the number of cases per day drops to less than 1,000. If that happens, would the CE consider relaxing the measures early? And my third question is about the consumption vouchers. Consumption vouchers would be distributed in April. Would you consider dispersing the vouchers in early April? We conducted a lot of assessment on a CUT exercise. Our assessment was based on the assumption that 7.2 million residents and non-residents in Hong Kong, and we need 500 testing stations. During the election, there were 600 polling stations, and the testing stations must operate around the clock. And if we have a 3-day cycle, we need 2.4 million staff, and we need an online reservation system, or else there would be long queues. For the 500 stations, I mentioned we need 45,000 staff members in 2 shifts. For mainland sampling offices, 9,000 people would arrive in Hong Kong every day. These were figures shared by mainland experts earlier. And since these officers have to travel across the border, and we need 2,500 staff and drivers to transfer samples across the border. For those who test positive, they have to be transferred to community isolation facilities. We need 1,800 drivers, and we need 3,000 staff members to man hotlines. For discipline service staff under the security member, we need 21,000 people. That brings the total to 80,000 staff members. So in terms of expenditure, I think that is not the priority. We must first ensure we have the right capacity. So this is certainly a massive exercise. I took in views from many people, including legislators, who said that we could carry out 3 cycles in a week or 3 tests in a week. We conducted detailed analysis, and we found that the task is certainly not easy at all. Apart from resources, manpower, and facilities, well, the mainland experts told us, frankly, that we are rather weak at mobilizing resources in the community. So we could not mobilize residents rapidly, and on the mainland, they have excellent mobilization power, and they were able to ensure that nobody was missed. That is how universal testing could be effective. If we always miss out on certain people, well, we have been reminded by mainland experts to pay attention to our ability to mobilize people. And even if we have a legal basis, can we ensure that there is 100% compliance? We saw that the answer was no. For compulsory testing, people who don't comply would be penalized. They would face a $10,000 fine. In terms of the non-compliance rate, looking at the RTD operations yesterday, that is residents who did not conduct tests or wear wristbands. The non-compliance rate was as high as 16% in some buildings. We rung the bell of different units, and as much as 29% of the residents in some buildings did not answer the door. In Hong Kong, freedom is much emphasized, and our society is rather egocentric. It's hard to achieve total compliance in universal testing. I'm not saying that we won't do anything, but we must conduct a thorough analysis to ensure that the benefits outweigh the costs. So like I said in the conclusion, we must maximize results at the lowest cost and minimize the impacts of the pandemic on socio-economic development. And this would apply to CUT. If we pay a heavy cost without ensuring good results, well, many people are still pressuring us in implementing CUT. I think this would give them some food for thought. Financial Secretary, consumption vouchers would be dispersed in 2 phases. We saw that owing to the state of the economy, many of them are under great stress, and we hope that the first phase would somewhat relieve their burden. Of course, we would look at the state of the pandemic as well, but our priority is to relieve the burden on the people. So this would be done as soon as possible. Would you consider relaxing the measures early? Like I said, the answer is no. Of course, some people are optimistic that the pandemic would ease rapidly and the number of cases would drop to 3 figures. But like I said, we must boost the vaccination rates and relieve the burden on hospitals. That way, they can reinstate their treatment capacity, and we must help restore the capacities of RCHEs as well. So there's very limited wiggle room if we further relax the measures, risk could be created on the RCHEs and hospitals. This is something no one wants to see. So once again, I urge the public to maintain stringent social distancing and get vaccinated. That way, in the next 4 weeks, life could resume gradually in Hong Kong. This is the end of the press conference. I will allow 2 more reporters to ask questions.
三個位男
Gentleman in white in the middle, please. Chief Executive, Phoenix TV. In the mainland, a lot of cases were brought in. In Hong Kong, we have seen the turbulent times, and we are seeing a downward trend for the measures to be relaxed. So will this lead to any rebound? Are you going to be able to guard against any importation of cases in order not to waste all the efforts? Now, for those between 3 and 11, there seems to be a downward trend. Are you sure you will be able to resume in-person classes in April and also the DSE? First, we're still guarding against the importation of cases and also guarding against a spread in the community. For the lifting of the flight ban, in many other parts of the world, they ban even their own people from coming back. We implemented these measures with gritted teeth, and right now there is no more justification to ban the flights anymore. Now, after all, we have limited supply of the quarantine hotels. If we allow people to serve the quarantine at home, then you would say that we are relaxing really too much. Now, we're not relaxing to such an extent that we are not guarding against any importation of cases. We're just rationalizing the situation to make sure that a lot of Hong Kong residents stranded in these 9 countries will be able to come back to Hong Kong gradually. And all the anti-pandemic measures upon arrival is more stringent than others. They have to have the COVID shots, and they have to have the negative PCR negative results. And after 10 hours of flights, and they touch down, and they have to take a PCR test. And upon testing negative, and they will be sent to the quarantine hotel in dedicated transport, and they have to undergo the RAT tests on a regular basis. On day 5, there will be a PCR test. On days 6 and 7, and there will be RAT test. It's only when they test negative that the order will be lifted. From January to March, the number of people coming to Hong Kong is very small. And for positive cases, the number at the test and hold phase and in the hotel is not particularly high. Upon arrival, the number is 1.9%. And we have picked them up and we send them to the isolation facilities. And 95% of the people tested positive on day 5. So nothing is foolproof. It is all a matter of risk management. I'm sure this is the same thing in the mainland. And our standard is very, very stringent as far as risk management is concerned. I agree that a lot of people, including people from the mainland, have made contribution to the fight against COVID. We have to guard against the importation of viruses and also guard against the spread in order to stabilize the situation. Now, 3 to 11 years old, the percentage is 57%. We hope in the coming month or so, we should be able to bring this up to 90%, I think we need to have the support of the parents. Now, 3 to 11, we are talking about the primary students and kindergarten students. We're seeking for them to resume face-to-face class with inoculation. They will enjoy more protection, and there will be better immunity for the cohorts, and they will be able to resume more activities. Now, why am I so concerned about class resumption? It's because some students need to be in schools. The online teaching, however good, will not be a substitute for on-campus classroom teaching and also the interpersonal relationship. So after Easter holiday, they will be resuming. For the DSE, there are still some considerations, so that's why we have the contingency. If this cannot happen, then we'll have to put it off until May. So every measure that we adopt is not taken willy-nilly. We have the scientific consideration and careful evaluation, and we have struck a proper balance now before we are able to announce the results. Let's fit in the last report at the lady in white, please. News. There are 2 questions, if I may. Now, for the inbound travelers coming to Hong Kong, days 5, 6, and 7, if they test negative, they can leave and quarantine hotel. Will the government be fitting them with the wristband? And they may be living with their household members who will not be under any control. Will there be any risk of spread? And you're going to be distributing the RAT kits. How are you going to do it? Will you be distributing them together with the supplies made available by the mainland? First, about the measures starting from the 1st of April, all the residents from these 9 countries will be able to come back to Hong Kong. And this is not much of the way of relaxation. This is a rationalization measure because we put these 9 countries in the flight ban list because we had regard to the COVID situation in these countries. After 2 months and with the support of the mainland, the pandemic situation has stabilized, although not to such an extent that we see a downward trajectory. So we have to be very careful in our assessment. So when they come back to Hong Kong, as I said, we are rationalizing the situation. Now, if they test positive, for people in Hong Kong, if they test positive, they can isolate at home, and they can, on day 6 and day 7, if they test RAT negative, then they will be able to resume their normal life. And they don't need to be fitted with an electronic wristband, and their family members don't have to be quarantined. If we're talking about a infected person, the family members will be quarantined. Now, for these inbound travelers, the situation is the same.
Your second question was about the distribution of anti-epidemic service kits to all households in Hong Kong. Like you said, this is possible thanks to the strong support offered by the central government. The supply of medical supplies in Hong Kong have been ensured, and they can fulfill the needs of our frontline workers, and we have procured sufficient quantities to distribute them to all members of the public. In the anti-epidemic service kits, they would include N95 masks as well as rapid antigen test kits and proprietary Chinese medicine. The kits also contain pamphlets on epidemic prevention. So the distribution could not be taken up by the SAR government alone. So I'd like to thank Legislative Council members, their officers, social organizations, religious organizations, kinship associations, as well as the Hong Kong Community Anti-Coronavirus Link, as well as numerous volunteers. I believe 5,000 to 10,000 volunteers are helping with the distribution work. Most importantly, I'd like to thank the central government, because without their staunch support, this exercise would not be possible. This is the end of the press conference. We will not hold a press conference tomorrow. See you later.